Today, can older people have filler too? Of course they can. Hi guys, my name's Dr Sarah Tonks. I'm a cosmetic physician working right here in London. I'm often asked by patients, when is it too late to start having something done? There's no easy answer to that question. I have people who have started doing injectables even in their 80s. It really depends on the individual. We've got a lady here with us today who has never had a needle near her face whatsoever, but she's looking to feel a little bit more refreshed. She'd like to have an injectable makeover. So the question is, for her, how did we do it? And what can be done? So you might be interested to know that Botox is only licensed for use until age 65. It can be used over age 65, but it's used what we call off-label, which means that if your doctor is using this particular drug for you, they need to have that discussion that they're using it off-label. Of course, you can still use it at any age after 65. It's just not what the drug was originally licensed for use for. With fillers, there is no such off-label usage because fillers are not classified as a drug. They're classified as a medical device, and there isn't kind of an upper age limit even which the manufacturers would normally suggest. So let's take a look at our patient today. She's never had anything done, so we're working with a fresh face here. It's very exciting. Going from the top, you can see that there's a little bit of a discrepancy in the eyebrow shape. This one is a touch more peaked than the opposite side. We've also got a little bit more volume loss right here in the upper part of the eyelid. This heaviness in the upper eyelid, I can't really do anything about. She will get a little bit of an improvement if we do some Botox there, but ultimately, if we're gonna completely eradicate or tighten this area, it needs to be surgical. We do have a few character lines around here, which are quite nice. We've got some puffiness and hollowness beneath the eye. This really does contribute to the perception of her looking tired. And of course we've got some tissue descent. So you see this sort of heaviness to the lower part of the face there. It's really because we've lost a lot of volume in the cheek here. And what we really need to do is vector the face. The eagle-eyed amongst you will have seen that there's a discrepancy in the lip shape. So you can see this part of the upper lip is much higher than this part. We've also got a bit of crepiness of the skin of the upper lip, and also some crepey skin sort of around this area here on both sides. You know, often I will say to a patient like this, if they do come in presenting with quite a lot of laxity of the skin of the neck here and these sort of heavy necklace lines, I'm very limited with what I can do in this region. It's never going to be as good as having a surgical facelift, of course not. But if for whatever reason the patient can't have or doesn't want to have a facelift, there are a few injectable tips and tricks that we can use to give an improvement in that area, but nothing for her is going to be as good as something surgical. And I work quite a lot with surgeons, so I like to refer out, let the patient have their surgery, then when they come back, I can focus on just maintaining that result for them. But in her case, surgery wasn't going to be an option, so I did what I could. And remember guys, all these results that you see, they're all created in one appointment. So even in her before and afters, if I'd seen her again, I would be able to get an even larger improvement than we currently have got. So let's look at exactly what we did. Let's start off with some toxin. We do the frown lines around the eye, the nose, that's for the bunny lines. Moving back to the forehead, DAO, mentalis muscle. This is where it gets interesting. You guys have seen all that other stuff before. It's kind of boring by now, right? Well, here I'm going to inject the masseter, which is this chewing muscle, but also an awful lot of platysma underneath her chin. You see her making her face like this. Well, this muscle, which is a sheet muscle, which goes all the way around the neck, it attaches to the lower border of the mandible. It really is pulling very tightly on her, and it's making her jawline look worse than it actually is. So if we relax that sheet muscle, it will allow the tissue to fall back in a much nicer way there. So I'm really just peppering a lot of toxin all the way around her platysma there. Now I'm going to draw in her cheeks, as I am wont to do. Pretty much do this every time because I want to see where the point of maximum light reflection should be. And we're starting here with a bit of radiesse into the cheekbone. Following that up with doing some small injections on each side of the face, right in front of the ear. And what this does is, again, help to lift everything up, pin it all back. One of my favorite injections coming up now, which is the base of the nose, helps to smooth the nose to mouth line. If you've seen any of my previous videos, you'll know that if I'm going to do a tear trough, I like to do everything that's around the tear trough first before I actually do the tear trough. And the reason for that is it means that you'll need to use less product within the tear trough. You can see I'm using a cannula right now to go up into the lowest part of the tear trough and deposit quite a decent amount of product there. Let's have a look at half and half of that. I'm going to go down and have a look at the lip now. I'm using a cannula in the upper lip, not actually in the lip itself, but just above there. And what that's doing is filling out this portion of the upper lip, which allows the lip to rotate up a little bit and also improves those vertical lines. It will also stop the lip from appearing kind of a bit ducky if we do go on and inject the lip itself. And from the same entry point, I'm going to go up and do some more work around the base of the nose. She's actually had quite a lot of product placed around this area, either with the needle or with the cannula, as you can see here. Now we're going down to the chin crease, using a cannula there as well, and giving more support to the cheekbone. This technique is often called next top model because you'll see that a lot of attractive, both men and women, will have this quite cut effect of the cheekbone here, but we can use it in anyone. Going back to the lip, injecting the border of the lip with some Volbella, upper and lower lip, and then we're injecting from the philtrum, which is this line right here, to the medial tubercle, which I'm sure you guys will all remember is the middle part of the upper lip. And then we're going to inject the lower lip, middle third only. Okay, so let's see what we got. I think it's pretty good. Let's look at the neck. You can see that by injecting the face, we've actually made quite a decent improvement to these necklace lines, which is quite interesting. These are necklace lines here. And I think that's also partially because we did so much toxin in the neck as well to relax that muscle. You can imagine with another few treatments, actually, it should make an even better improvement than we currently see. You can see that we've really decreased a lot of these crow's feet here. She's still got them, but just not quite as many. And this tired appearance with the bag underneath the eye, much softer. In fact, the overall expression of the face appears to be a little bit softer and more serene. The vector of the face has changed quite a lot. You can see here we've got the sense that we're quite square, and we've got a bit more of a V shape going on in the afters. The shape of the lip is still the same. It is a little bit more symmetrical, so I've managed to take this section up very slightly to match the opposite side, and we do have more fullness in the lower lip. She's an interesting one. What would I do if I was going to treat her again? Well, I would for sure do some more contouring, so I can definitely take this up further than it currently is. So I'd work on the cheek some more. I'd do those little injections in front of the ear again to take that back. I'd also, at this point, probably inject directly into the tear trough itself to improve there. I'd probably do the temple as well, you know. Not to give bulk to the temple, it's more to give a little bit more lift. And once I'd done that, I'd come down, maybe I would do the angle of the jaw to see if I could get a bit more lift. And I'd probably finalize the lip, so try and equalize this a little more and improve these lines more. By the way, guys, one of the questions that I get asked quite a lot is about this line here. See those lines that sometimes people get across here, and often I'm asked, can you fill that for me? Well, the best way actually to tackle a line like that, for your information, is to inject around this sort of area here, because that's where the deficiency is. That area has all stepped back, which has meant that the skin here starts to concertina up. So by doing injections around the base of the nose here, you'll bring that forwards and wind up stretching that line out. There's a lot of anatomy going on around there, so you do have to be extremely careful of who you get to do your injections if you are going to go down that route, because you can wind up occluding a blood vessel there, or this is on the pathway straight to the eye. So there have been a few cases of patients who have been injected in that region who unfortunately have become blinded as a result. So not to scare you guys, but complications can and do happen with dermal fillers sometimes. So yeah, choose your injector wisely. Okay guys, so that's it for this week. I hope you enjoyed the video. If you'd like to see this patient back again, let me know in the comment section below and I will see what I can do. In the meantime, don't forget to like, comment and subscribe, and I will see you again next week.